Thank you, Kazuaki. Any comments from the panel? Hugo, any comments from you? Word of wisdom?
Well, in these cases, what first sometimes fellows try to do is to think of doing laser because of the tear. Our experience based on several years of subretinal surgery, like when we were removed CNVs, we know that any of these tears in the posterior pole don't need a laser to seal them. So what I recommend in these cases is what he did is just finish peeling, clean up everything from vitreous and membranes, and this will heal by itself.
Yes. Great. So the one point is that if you have a posterior break, you do not need to do the laser treatment. The second point is that if you ever get bleeding, which sometimes happens, the first thing you want to do to increase the intraocular pressure that prevents the blood to get under the macular area, and then at that point, you can figure out what you want to do. And as Kazuaki pointed out, many times these patients do fine as long as the foveal area and the central macular area is not involved. Kazuaki, it looked to me that the magnification was very high, and you were almost, one of the things I noticed that sometimes when the lens is a little bit tilted, that you get a prismatic effect of that lens, and that gets into your depth perception that you are not, what are your thoughts on that?
Right. I'm routinely use a magnified contact lens for microsurgery. The micro contact lens has a disadvantage and also advantages. Disadvantages is less visibility to the far away from the center, and we have taken care of by using the magnified contact lens for microsurgery.
Yeah, the key is that many times during the peeling, you pretty much always want to be in the central area of the lens. Once you're getting towards the corner of the lens or on the side of the lens, then that's when you want to center the lens to hopefully prevent this from happening. And obviously, when you have increased magnification, you want to prevent this. One additional point is that if you operate on a patient who has a high myopia or staphyloma, in those patients, during the peeling, you want to lift the forceps and not just go parallel as you usually do, because if you do so, you may hit the wall of the staphyloma, and similar thing to what just Kazuaki showed.